Hi, my name's Daniel and I'm making another video just to answer some questions about scoliosis that some people may have. You may or may not know, last year around the 24th of July I had spinal fusion surgery. I had S-shaped scoliosis in my spine. I also had some minor kyphosis, which because of the way that the spine curves, my neck was sort of pronounced forward and my back was partly hunched. Some of you have different types of scoliosis. Some of you have C-shaped, some of you have S-shaped, some of you have minor rotation, some of you may have larger rotation. And depending on how your scoliosis may have progressed through your childhood, you may have uneven ribs. Sometimes people will have a pronounced rib hump, pronounced shoulder blades. I had a rib hump. I had a fair amount of rotation, 55 to 60 degree curvature, and I was diagnosed in 2002. I didn't have my operation, however, until 2012. So it was 10 years from first diagnosis to actually having the operation. Now, a lot of people are scared of the operation and the procedure involved, and to be honest, it's perfectly feasible to be scared of the operation because it is a major operation and it will take time to recover. But I wanted to sort of allay some of the fears that some of you may have. I speak to quite a few people that are pending to have the operation. I've spoken to people that have backed out of the operation, and through no fault of their own, just a lack of understanding is sometimes enough to put people off of going through with the operation. So the most common question that I come across is, will I be paralysed? There is no way to say that you are more at risk of being paralysed than someone else. I wouldn't want to sit here and say paralysis isn't going to happen, but what I will say is that the chances of paralysis are so small, they are almost non-existent. And the reason for this is because the technology that they use during surgery now uses an ECG, like an electrical pulse system, that they send the electric pulse through your feet and they pick it up receptors at the back of your head and the back of your neck. What that does is that monitors the electrical flow through your spinal column during your operation. So when they're correcting the spine, which is when the risk is most prominent, the readings taken through ECG are used to monitor for disturbances. In the event that there are any disturbances and that there is a risk of paralysis, they generally will stop. They'll stop the procedure, possibly undo anything that they've started, and then bring you back round and look at alternative treatments. So the risk of paralysis is actually very small. People quote different figures. I've been told by some consultants as little as 1 in 500, some in 1 in 1,000. But generally, I wouldn't even say it's that. And on top of this, the people that are used statistically that have been paralysed may have had underlying conditions that exacerbated the risk. So generally, I would always opt for surgery rather than to ignore it on the basis of the risk of paralysis. So I wouldn't worry about being paralysed as a main risk. I'd say the bigger risk and the one to take more notice of is infection. Infection is actually the main risk more than anything else. Obviously, your spinal column is critical for the transport of blood, nutrients, as well as all your central nervous system. So exposing that part of the body during surgery and then obviously staying in hospital after that, the risks of infection are actually more than the risks risk of paralysis. Now, I had my procedure done at the Royal National Orthopaedic Hospital in Stanmore. Now, I believe there's only 1 or 2 places around the country that actually do the surgery or specialise in it. Royal National Orthopaedic Hospital in Stanmore, unfortunately, is an old hospital, built 1900s, so it does look slightly run down, but I have to say the staff there were fantastic. It was kept very clean. I think the main risk of infection is generally just from poor self-hygiene, or if you have any visitors that are unwell or likely to bring anything with them, that is when you're more at risk. Smoking. Smoking is also a bad thing in the sense of nicotine weakens your immune system. It also interferes with bone development and growth. So I suggest if you do smoke and you have scoliosis, quit. I smoked for 8 years, 20 a day, 30 a day, so I smoked relatively heavily. And I went cold turkey, and I've now been smoke free for, I'd probably say, about 14 months. You need to quit smoking before you have the surgery. There's no ifs or buts to that. I do not condone smoking. If I can do it, anyone can do it. Other than that, the main risks, I guess, are relative to infections. So take some clean clothes, some antibacterial wipes or hand gel, alcohol rub, and just generally don't have any visitors if they've been unwell, or if they've had any problems or anything partly contagious. So you want to sort of keep your area, your hospital bed, as sterile as possible. Sometimes it might be ideal for visitors to bring a sheet or something for you to lay on, because unfortunately the NHS is stretched, so sometimes they can't always change your bedding, and you'll generally find your dressing will bleed, there will be some blood loss. But other than that, I had the operation, and it was the best thing that I ever did. Best thing, hands down. I wouldn't turn the clock back, and to be honest, I made a much bigger thing of it than I ever should have. I was scared, I felt ill, I was worried, sleepless nights. I was just terrified, you know, of the prospect of what they're going to do. But if you look at it from the other point of view, number one, spinal surgeons are one of the most skilled surgeons that there are. They have to undergo years and years of medical training before they're allowed to do any operations, so they are very, very highly skilled and qualified. As I said, they do the operations day in, day out, so they know exactly what they're doing. Thirdly, you're under anaesthetic, so it doesn't matter if you are having a kneecap fixed or a toe fixed or anything like that. You're asleep, you do not know. When you wake up, you're high as a kite. I was over the moon, felt unbelievable, felt so happy that years and years and years of back pain, having a hunchback, and all of that were finally gone. No more. Literally, I laid there before the operation, they put me to sleep after some pre-meds. The next thing I know, I woke up and my life had changed. Literally just like that. Now, the second question is recovery. There's no right or wrong answer for recovery times, because everybody is different. Some people will recover better than others. I was in hospital for 4 days. 4 days. They wanted me to stay for 7, but they said that I was well enough to go after 4 days. So I discharged myself after 4 days. Recovery is difficult. That is probably something you should take into consideration more than the risks of surgery. You are limited to what you can do. Generally, the first 3 months are the worst. They're the most uncomfortable. It took me about 6 to 8 weeks before I could get a good night's sleep, before I stopped getting chest pains in the morning, because you have to remember they're interfering with a lot of different things. They're not just adjusting your spine. Your muscles, if you've had scoliosis for a number of years, your muscles would have toned themselves based upon the contours of your spine. When that spine is straightened and the muscles are reattached, they're all out of shape, they don't sit right, so you may find yourself getting back spasms, stitches, and just generally uncomfortable. But the effects of I'm just trying to think the best way. Confidence wise, I felt so much more confident and happy with the results from my spine. I actually overlooked the pain, and the medication does the rest of it. Generally, you'll be put on a morphine-based opiate for the first week or two. Sevrodol is the most common tablet given. Solpadol is also another tablet that's given, and these generally get rid of a lot of the aches and pains, and they do a fantastic job. Recovery time will be months, realistically. Months before you can do anything again in the sense of lifting or carrying anything. You will be uncomfortable, unfortunately. Sleeping at night can be a bit difficult. I generally used to lay on my side, and then I used to have cushions placed either side of me, and a memory foam mattress topper. Right, I can't stress this enough. That made the world of difference. A memory foam mattress topper. They're about £70 to £80 for a king or double, and the memory foam works to support your back in different areas. So I highly suggest that. Another common question: what are the chances of the rods breaking? Nowadays, very, very, very unlikely for any equipment to ever fail or break. And the reason for this is because the equipment that they use now, other than the old Harrington rods, is like a new ratchet system. They're made of titanium, pure titanium. So they are almost indestructible. They will support your back throughout the fusion process, but after the 6 to 12 month mark, the rods don't actually do anything. They're there and they provide additional support, but the healed bone fusion does the rest of the work. Don't need anything else. So those, I guess, are the most common questions. I'll do another video because I'm not sure how long your videos can be on YouTube now, but those are the main questions. I'm now a year and 2 months since I had my surgery. I'm pretty much back to normal. My back feels great. The only side effect, unfortunately, is I did lose some of the feeling around the scar area. I lost some of the feeling in my back, in the sense of if you were to touch my skin and run your hand down my back, I would lose the sensation of you touching my back. But to be honest, that is the most minor price to pay for what is now a very straight spine. So I don't know how well you'll see, but my back is now nice and straight, whereas before I was over like that, and now my back is straight. So for those of you that are due to have surgery or considering surgery, I would say go for it. Do it, because you're in the hands of some of the most highly trained people. Technology has come a long way to preventing things like paralysis and other complications. So I would go for it. By all means, if you wish to contact me, you can do so. Follow me on Twitter at Daniel Foley. That's DANIELFOLEY. And feel free to drop me a message on Twitter with any questions you may have. And yeah. So anyway, hope you have a nice day. And if you have any questions, give me a shout.